The treatment of prostate cancer, if one is found to have it, is personalized. Historically, we overtreated many prostate cancers. We removed many prostates. We radiated many prostates. The biggest change in prostate cancer care is how we approach this. Today, we know that many men do not need immediate treatment at all. We know that it is safe to perform what is called active surveillance, which is otherwise regular monitoring of prostate cancer. The intent of this is to delay treatment until it matters. Hopefully, in many cases, it can be delayed as long as one lives, so as not to expose that patient to the side effects of treatment. However, the benefit of it is that watching does not mean ignoring. Watching means intently monitoring it so that if the cancer is upstaged, it is still within the window of cure and it can be treated. And if treatment is needed, I think that nowadays we are much better at preserving the natural body tissue that are important for quality of life metrics, i.e. erectile function, urinary function, and GI, bowel function, after invasive treatments for prostate cancer. I tell my own patients that prostate cancer surgery in 2025 is kind of like skinning an onion. The onion, the meat of the onion is the prostate, but there are many layers around the onion that are appropriate. And selection of which layer and preservation of the peel of that onion, which is the natural body tissue, is a nuanced, careful surgical skill that many of us who do this type of work have in 2025, and it's much better understood. And so outcomes like erectile dysfunction, urinary dysfunction are significantly reduced in this era. I think the outcomes within the radiotherapy sphere are significantly better. Radiation oncologists can talk to you better about this, but their approach is much more direct and focal than it used to be. And with regards to the focality of treatment, there is a whole avenue of treatment called focal therapy, which includes things like HIFU and cryotherapy and nanoknife. All of these are ultimately designed to treat the cancer and not treat the entire prostate in the vast majority of cases, and not and certainly de-intensify a lot of the side effects that we are talking about. And they are appropriate. We know based on data that these treatments are appropriate for a variety of men in prostate cancer, thereby giving them a good cancer outcome and quality of life outcome. And all of this is a nuanced conversation. This is all thought about very judiciously when a patient is seen for this problem. It is not that we rush men from elevated PSA simply to biopsy to removing their prostate.